My name's Karina. I'll be doing my project on the opioid epidemic, specifically in the United States, what it is, how it started, and what we are doing today to make sure that we can take the proper steps to try and stop it, or at least make it better. So, starting off, what exactly is an opioid? Opioids are drugs that interact with the opioid receptors that we have in our brains and in our bodies. They are most commonly used to relieve and treat pain, chronic pain, or pain after procedures such as very invasive surgeries. They are prescribed by physicians for reasons that are justified for having to use such a strong painkiller. They are safe when prescribed by a doctor and when they are used at the right dosages that they are prescribed for and when they are used for the right amount of time. They can become dangerous once they are used for extended periods of time, and they are said to cause a feeling of euphoria and relief, which is one of the common reasons that many addicts state that they started abusing these drugs because they were after the feeling that they felt when taking said drug. There are many different types of opioids. There are prescription opioids, which are the ones that the doctors prescribe for pain, to relieve chronic pain, or as stated, when there is pain caused by disease, maybe cancer, or procedures that were done, such as hip replacements, knee surgeries, back surgeries. The most common are oxycodone, also known as OxyContin, hydrocodone, also known as Vicodin, codeine, and morphine. And there are also synthetic opioids, which include fentanyl, most commonly seen as fentanyl patches when used in medical uh, settings, and also heroin, which are the illegal street drugs and the illegal versions of opioids that are most commonly found on the street and sold illegally. Synthetic opioids such as fentanyl and heroin are usually the ones that people go to after they no longer have access to their prescription ones, as they are easier to get on the street illegally and usually cost less. So, how the opioid epidemic got its start? It started in about the 1990s, mostly the late 1990s, where it became very common for physicians and doctors to prescribe opioid painkillers. It was promised by pharmaceuticals companies that these drugs were not addictive and that they were safe to take, which they are, as stated, when used properly at the right dosages for the right amount of time. But because these pharmaceutical companies promised that they would not be addictive, there was really no rules or regulations behind the dosages, behind the prescriptions, behind the refills these physicians were getting out. It would later become known that these prescriptions are actually very highly addictive, and by then there would already be a number of people addicted because there was nothing stopping them from getting multiple refills or anything like that that would help them not become addicted. So this is where it usually started, where doctors could easily prescribe these, and there was no other alternatives. They would go straight to opioids. So some opioid addiction by the numbers. This is based off the year 2019. About 70,630 people died from drug related overdoses in the year 2019. About 1.6 million people have an opioid use disorder just in the year 2019, and of those 1.6 million, 745,000 use heroin or have used heroin just in that year. There are about 1.6 million people who misuse prescription pain relievers for the very first time, and these very first time offenses can eventually lead to an addiction. There are 48,006 deaths related to overdosing on synthetic opioids. That is not related to methadone, which is an alternative. So this would have to do with fentanyl or heroin. There are 10.1 million people currently misusing opioid prescriptions, or at least in the year 2019. Just in that year, there are about 10.1 million people misusing their prescriptions. About 2 million people use methamphetamine. 50,000 people in the year 2019 used heroin for the very first time. and about 14,480 people died from just overdosing on heroin. So this was all related just in the year 2019. All the people who used drugs for the first time, started abusing for the first time, or also had related incidences, death-related incidences regarding opioids. So some things that are being done to help this epidemic when it comes to prescriptions and physicians. There are now rules and regulations regarding what kind of illnesses or circumstances could qualify for an opioid prescription. And there is also more regulations on how strong the doses are and how often someone can get a refill. So even if someone were to abuse all their medicine and run out, they cannot get a refill until it's time for them to actually have that refill, which is when the time was stated for them to actually have gone through all their medication. If a physician or someone who's able to prescribe is caught doing something that they should not be doing, giving them out for the wrong reasons or too much, they could lose their license and they could use their ability to practice, which all these things make it harder for those who abuse prescriptions to get their refills and to use more as they want. And there's also more research being done on alternatives that can be done to help treat things such as chronic pain, which can be more beneficial instead of using opioid painkillers all the time. And some other things being done, there is an increase of needle exchanges, clean needle exchanges, which helps lessen the risk of contracting and spreading other diseases that come through addiction when using needles to administer drugs such as heroin. This helps avoid spread of illnesses such as HIV and hepatitis. There's also easier access to mental health counseling and rehab centers where people can go to try and uh, stop their get their addiction under control, as well as clinics such as methadone clinics where they use such medications such as methadone to try and help people stop using other harsher street drugs such as heroin and eventually wean these addicts off even methadone so that they can be sober and they can be clean. And there's also more access to overdose reversal drugs such as naloxone, which is able to help reverse the effects of an overdose and in that way prevent overdose related deaths. Here are my references. It is also very important to remember that drug addiction is an illness, it is a disease. There is lots of bias surrounding um, addiction and those who are addicted to drugs. It is important to remember that there is always help, there is always mental health counseling, rehab centers, and many other things that one can do. It is never too late to get help, and it's very important to get help in order to prevent a bigger epidemic or more overdose related